Hello, my name is Dr. Louise Hanson, and I'm the Medical Director at the Student Health Center. Dara Dixon, who is our clinic manager, and I will be presenting information on this slideshow about student health insurance at Vanderbilt to help assist you with navigating the U.S. healthcare system. We will also be presenting to the students during International Student Orientation. Healthcare in the United States is one of the most comprehensive care systems in the world. Unfortunately, it's also one of the most expensive systems in the world. And it is for this reason that Vanderbilt requires that all students at the institution have adequate health insurance. Health insurance will help protect the students against financial stress and liability in the event of an unexpected injury or accident or illness. In addition, having adequate health insurance allows students to receive health care that they may need in order to be successful students at the university. Health insurance in the United States is not government funded and is privately paid by each individual. Vanderbilt University works with the Gallagher Student Health Insurance Plan, which is a comprehensive plan offered to all students at Vanderbilt University. This plan is required for international students, and all international students are automatically enrolled in this plan. If you have a child or children or a spouse who needs health insurance, you may also enroll your children or your spouse in the Gallagher Student Plan. On the next few slides, we've included some of the terms that are commonly used in the United States when talking about healthcare. We thought it would be helpful for you to have access to these terms and be able to review them, and of course at orientation you'll be able to ask questions. So a provider is anybody that gives you health care. That can be a doctor, a hospital, a nurse, a pharmacy, a lab where you have blood drawn. Your primary care provider or physician, also called the PCP, is the person that really is your go-to person for your health care. This is the person, more often than not, that will be at student health, unless you have somebody outside of student health. But for most of our international students, this will be a doctor or nurse practitioner at Student Health who is here to help you. This is the person you'll see when you're sick. This is the person that can help you see specialists outside of Student Health if you need care. This is the person that can help you do the insurance paperwork and really help you navigate the healthcare system while you're here at Vanderbilt. The insurance company that assumes the risk and the payment of your claims anytime you use the health insurance is also called the underwriter or the carrier. Your insurance company, and it's printed on your insurance card, is called the United Healthcare Student Resources Plan. The claims company, also called the TPA, or third party administrator. This is the company that your insurance company uses to really do the business of the claims. So this is the company that files, does the paperwork, distributes the payment, and communicates with you about the status of the payment. Your TPA is called a company called HealthSmart. Gallagher is the company that helps oversee both HealthSmart and United Healthcare and maintains the website and makes sure that any questions you have are answered, and works with us here at the Student Health Center to make sure that things are going well and that claims are being paid and that everything is coordinated. Premium is the amount you pay for your insurance per year. The deductible is the amount you will pay before the plan starts to pay for your health care. So if you have a broken arm and have to go to the hospital and have x-rays and see a orthopedist who helps you with your arm, and you have surgery on that arm, and you have to pay for all those things, you will pay at first. The first part you will pay is called the deductible. After you pay that deductible, which is usually billed to you later, not during the time you're at the hospital, you will pay that amount of money, and then after that is when the insurance starts to pay their part. The deductible varies by whether you are an undergraduate or graduate student. It also varies by where you get your health care. It is also always most advantageous to you. It's to your benefit to get health care at Vanderbilt because the prices are lower. Your insurance also has a couple of separate deductibles. It has a separate emergency room deductible. So if you go to the emergency department after hours, rather than waiting until the next day, then you will be charged an emergency room deductible before the insurance pays. In addition, you will have a separate prescription deductible. So the first time you go to the pharmacy at the beginning of the insurance year, you will first pay $100 for your prescriptions, and after that you will have lower prices for your prescriptions. So the part that is your part is called the copayment or copay. So after you do your deductible, then your insurance will kick in. If you get care at Vanderbilt, you will pay 10% of the bill, and the insurance company will pay 90%. And you can see here the other numbers, that if you get care outside of Vanderbilt, but in a preferred in-network clinic, you will pay 15%, and the insurance company will pay 85%. If you're outside of Vanderbilt, you will pay 35% of the bill. And as I mentioned earlier, in addition, if you go to the emergency department and do not have to go into the hospital from the emergency department, you will also owe an additional $100. So it is to your benefit to use the Student Health Center. It's to your benefit to use Vanderbilt for your health care. The out-of-pocket maximum is the amount of money that you have to pay at most per year. This varies by where you receive your care, and is available. This information is available in the insurance plan brochure and online on our website and on the Gallagher Student Health website. A claim is the paperwork that your doctor or hospital sends to your insurance company and asks them to pay. Again, the co-insurance or co-payment, which I mentioned earlier, is after the insurance company pays your doctor or hospital, this is the part that you will owe. For each illness that happens outside of Vanderbilt Student Health Center where you receive bills, you will also receive from the insurance company a document called the EOB, or Explanation of Benefit. This will list the total charges, the charges that the insurance company discounts because of being at Vanderbilt, and it also includes the amount you will ultimately be billed by your doctor. So when will you need insurance? If you're seen at the Student Health Center, there are no charges for most office visits here. This is a benefit of just being a student. However, if you need to see somebody outside of Student Health Center, if you have to go to the emergency room, if you need lab tests, if you need medications, all of these things will require that you use health insurance so that your costs will not be terribly high. So how do you use your insurance and how does it all work? If you are seen outside of the Student Health Center, please always have your insurance card with you. You will need to show this card to prove that you have insurance. When you're seeing a specialist in a clinic, such as, for example, a heart doctor or a stomach doctor, they will not usually ask you to pay any money at the time of your visit. However, if you go to the emergency department for an injury or illness that you do not feel is uh, something that can wait until the Student Health Center is open, they will require before you leave that you pay the $100 copay at the time of that visit. So make sure that if you do have to go to the emergency department, that you are prepared to pay this money. For most hospital visits and clinic visits, the EOB will be sent to you and the bill will be sent to you later. It is very important that you read any information that is emailed or mailed to you because sometimes there is paperwork that you may need to fill out and provide additional information to the insurance company before they will pay. You can print your insurance cards from the Gallagher website, which is listed here. We can also assist you at the Student Health Center, and we're happy to do so. That's why we are here. We're here to help you. If you have questions or problems with printing your card, or if you have any other questions regarding your insurance, we are here to help you. Many students have questions about how to use their insurance at a local pharmacy to buy medications. I've mentioned earlier that the pharmacy benefit has a $100 deductible. Again, this means that before your insurance kicks in and starts paying for your medications, the first $100 is your responsibility to pay. After you've fulfilled this $100 initial payment, each medication that you buy at a local pharmacy will be covered at a set price that is determined by what kind of medicine you buy. Generic medicines are the cheapest medicines on the market and are really the most commonly prescribed medicines that we use at the Student Health Center. These medicines cost $15 a month, whether you buy them at a local pharmacy or whether you buy available ones at the Student Health Center. More specialized medicines that do not have a generic or are more expensive types of medicines are covered by your insurance company but are more expensive. And these, depending on the medicines, these can range between $50 and $75 a month. I've included here a couple of websites that you will find helpful, including the Gallagher Student Health Plan that has more information about the health insurance plan. I've also included a link to our website. It can tell you a little bit more about our services, and I've also created another PowerPoint slideshow that briefly goes into some of these services. We have a student health insurance representative here in Student Health. Her name is Christy Miller. She is here to help you. She's here to help you with waivers, with billing questions, with EOB questions, printing an insurance card. She is happy to help you, is very good at it. She really enjoys working with international students, and she really understands that a lot of these things are very foreign to you. They're very different from your home country's healthcare system and insurance system, and is eager to help you feel more comfortable with all of these things. You can reach her by just simply walking into the Student Health Center. It's probably best to call ahead and make sure she's at work that day. She's usually here, but to make sure that you don't miss her, it'd be best to call ahead. You can also email, and she'll set up a time to meet with you, go over everything with you so that your questions can be answered. Please accept our congratulations on joining the academic community here at Vanderbilt. We look forward to serving you. Please feel free to contact us if you have any questions. Thank you.